Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
Hey, everybody. Welcome back to JCO After Hours, a podcast where we get a little bit more intense, a little bit more specific about articles that are published in the Journal of Clinical Oncology. My name is Shannon Westin, and it is my honor to serve as the social media editor for the JCO. I'm an associate professor at the University of Texas MD Anderson Cancer Center and a gynecologic oncologist. And today we are going to be discussing a really exciting paper, which was published in the March online JCO. It's a Comments and Controversies piece called Prescriptions for Mitigating Climate Change Related Externalities in Cancer Care, A Surgeon's Perspective. And I have several guests with me today, none of whom have any conflict of interest. The first is Dr. Anaeze Offodile, who is an assistant professor in the Department of Plastic Surgery, as well as in the Department of Health Services Research at the University of Texas MD Anderson Cancer Center. And he also serves as the executive director of clinical transformation at MD Anderson. He is the senior author on the paper, so he will have a lot to offer here. But we're also accompanied by Dr. Elizabeth Yates, who has the title of clinical fellow in surgery at the Brigham and Women's Hospital in Boston, but tells me she's a rising PGY4 resident, which makes it even more impressive that she has already published on the role of climate change, or the role of the surgeon in climate change. And so we're so honored to have her with us today to share her perspectives as well. Welcome, both of you. Thank you for being here.
Happy to be here.
Thanks so much for having us.
So, I'm definitely someone that has been interested in climate change for some time, and living in the state of Texas, it does what I can to rally the political climate here. But I was really intrigued because I had never really thought of it in terms of what we do in the operating room. So I'd love for each of you to give just a little bit of background on your careers and how you kind of got involved with this idea of climate change and environmental sustainability here in the operating room and in medical care. Dr. You want to start, Ani? Yeah, that would be great.
Yes, although I'll defer to Liz. Liz can start first.
Okay. Go ahead, Liz.
Absolutely. So I actually came at it from an interesting perspective. I have always been interested in issues of resource distribution and disparities. And when I was in medical school, started to think about these issues pretty deeply, especially because my younger brother was at the University of Michigan at the same time as I was, studying environmental science for his undergraduate, and kept nagging in my ear about this problem of climate change and why I wasn't thinking about it as a doctor. And with my kind of ongoing interest in disparities, I came to realize and become passionate about the role that climate change will play in driving the existing disparities that we see both nationally and globally. And I realized nobody was really talking about it yet, at least in the surgical field. It had started to permeate some of the medicine subspecialties, but really there wasn't a conversation in our world yet. And it became all the more relevant to me because I did see this dual relationship where not only do the downstream factors of climate change, like heat waves and major storms, impact our patients' access to care and their outcomes, but on the flip side, we contribute to climate change because the delivery of surgical care, particularly in high-income countries, is so energy intensive and so wasteful. And so I felt like if any clinician has a role in this space to really lead and change the narrative, it would be us as surgeons.
That's great.
So I came at it, and it's really interesting to listen to Liz's journey to this issue, which affects all of us. I came at it from the micro level, bottom up level. So when I was a fellow about 4 years ago, under the mentorship of Nancy Perrier, we launched and have since scaled, you're probably aware of the Shannon, so the Know Your Cost project. So Liz, and for the audience, this is a project at MD Anderson wherein we really try to minimize cost variability and waste in our operating room by providing a feedback tool to surgeons that sort of made them more conscious about the spending directly attributable to disposable supplies, implants, devices in the OR. And one direct outcome of that project, we found that actually narrowing the variability in these disposable instruments, supplies, implants actually had no impact on outcome, but also got sort of the cost structure of what we do in the OR down. So that's sort of the value-based care proposition. And in doing this work, as I dug in more into literature, I learned, as we sort of highlighted in the article, my co-authors and I, that actually the perioperative environment is a major driver of waste in the hospital setting. And I think so that recognition certainly led to this work, which we're very glad that JCO was sort of looked upon favorably to champion.
Oh yeah, I love the Know Your Costs. My fellows make fun of me because I always take the electrosurgery devices. They're the cheapest, and they're like, "Oh, you're using the Costco version," and I'm like, you know what? We're reducing costs, so just hold it a little bit longer there, and you're going to be fine. So I was really struck with one of the first sentences out of the gate in your commentary that the healthcare industry accounts for roughly 8.5% of total GHG emissions in the United States, the most in the world per capita and in absolute terms. I mean, to me, that was like so eye-opening within the first few sentences. I guess, what are some of the other major takeaways that you hope that readers of the JCO kind of get from this piece? Ani, I think we can start with you, and then I'd be interested to hear your perspectives as well, Liz.
So I'll say a couple high level, and I can touch on the sort of the specific prescription that we put forward. But I think the big takeaways, one is sort of healthcare has a certain moral imperative to keep our contributions to sort of environmental sustainability, greenhouse gas emissions, to control that. There's a moral imperative to this work, right? One, sort of climate change, the effects are differential. So the vulnerable populations, like Liz said, tend to suffer the worst. So when you think about communities in the countries in the global south, they bear the brunt of this, not industrialized nations. And number two, sort of our activity directly maps to greenhouse gas emissions. And as surgeons, the relationship is much more direct. So sort of carbon intensive procedures like the robot, thinking about the perioperative environment in the supplies, the waste, and the supply chain that sort of feeds into that. So those are the things high level that I want to call out. And in many ways, this paper is intended to start a conversation that will be ongoing amongst the community, the academy, and I'll say both surgical and medical, with respect to what extent do we take ownership of this problem and contribute to the meaningful solution to this problem. And I can certainly talk about some of the recommendations we put forward, but I think that's the key takeaway.
Yeah, as not an author, but a reader of this paper, I really thought it summarized the high-level ideas and really did serve as a conversation starter in the best way. What I really liked, and I try to strive in my own work at our hospital, when we implement sustainability initiatives, was the perspective that you took coming from more of a cost-saving perspective initially, because I think people have a misconception, if they do ever think about sustainability and care delivery, that somehow quality has to be compromised, or for sustainability to go green, you have to do less. And that's not necessarily true. And you really highlight a lot of opportunities in the 4 domains you emphasize in this paper about how you can change the way your system works, or the choices you make for the devices you use or the energy supply, without actually compromising outcomes for patients. That, we can maintain high level quality, but make some smarter choices for our systems to also be more sustainable. And then a lot of the time, have cost savings. It could be a triple win, but we just need to put more time and effort in the surgical world thinking about these issues.
Liz, Thank you so much. What we tried to articulate was there is no trade-off between planetary health and value-based care or high-quality care. That I think those two are actually synergistic and certainly mutually reinforcing. So that's certainly one thing we try to. I'm glad it came out. Sort of like push forward certain theme there.
Well, and I think I was joking about our bipolar use and such, but that's really what I'm trying to teach our fellows is that you can do the right work with an instrument that doesn't cost as much. And in this case, the robot is a perfect. I was reading that as a robotic surgeon who also does laparoscopy, and I thought, gosh, when I'm making these decisions, this is such a trickle down effect. And so I really do think that I'm interested in, strategies to offset those things, because sometimes for us in gynecologic oncology, the robot is a superior tool as far as visualization and also surgeon back pain and such. But you really have to understand that trade-off for what else you're impacting. So I guess what can we do with the framework of this piece in mind? What can the clinical care providers really do across the country to meaningfully address climate change and improve overall healthcare sustainability?
So I will talk on the surgical perspective, and maybe I'll point to Liz to sort of bring a more broader outlook to this. But sort of we touch on four main buckets or domains of sort of activity. So one is the OR environment, right? Sort of thinking about type of anesthetic gases that we use, thinking about energy efficient lighting, thinking about sort of the heated ventilation, AC, HVAC. Can we sort of bake in preventative maintenance like on a scheduled time and using things called setbacks? So, for instance, don't have it run overnight when no one is using your OR. For the most part, there's always like emergency cases, but sort of when there's low foot traffic, like nighttime, could we sort of like not have the HVAC running during that time period? So there's certain like, I'll say low hanging fruit that we can do in respect to the OR environment. And as we think about building new ORs and new hospitals, let's bake in sort of an environmental impact assessment as we sort of commission these new environments. So that's one. Number two, the supply chain. And thinking about streamlining sort of the disposables, the gowns, the implants that we use, and really thinking about the procurement and the sourcing of these things, taking a climate change lens to picking vendors, picking partners, almost sort of requesting an audit for these vendors with respect to how they create these goods that are sort of big into the environment. The third thing is actually waste, and thinking about sort of the amount of waste that comes from the cost of surgical care. Can we lean more towards reusables as opposed to disposables? Can we think about reprocessing devices, sort of like the word is a circular economy now, but can we think about those type of like initiatives with respect to waste? And the last two, one is value-based care, specifically thinking about, low-value surgical care. Really, that's another way of saying activity that doesn't track to meaningful clinical outcomes. So that activity, if I were to reframe it, creates carbon that sort of worsens our greenhouse gas emissions, but doesn't track to any meaningful benefit to patients or society. So low-value care, de-escalating that or de-implementing that certainly could help with our greenhouse gas profile. And lastly, COVID has been a major forcing function for telemedicine. Can we think about telemedicine in a way that sort of optimizes traffic and transportation while keeping cost structure down and thinking about greenhouse gas emissions? So those are the 4 or 5 main sort of like elements that we've sort of proposed in our paper. And I would say pieces of this can be contextualized to a medical context. Waste certainly could be put in a medical oncology lens, as is virtual care, as is low value practices. So that's how we thought about it for this paper.
That's great. Liz, do you have any thoughts about?
I think I really nicely summed up kind of the categories of areas for implementation. So I think I'll keep my comments focused, one, on what does it mean to actually implement that kind of work, and then scale back and what can we do, as you highlighted, more broadly as clinicians. But as someone who's really started this work, we initiated what we call Watching Our Waste program across our procedural spaces at our hospital. And working with my mentor, Dr. Wynn, who's a vascular surgeon, has been really beneficial because having a clinical voice start to push and champion these ideas is really meaningful when it doesn't come from the administration or top down. It feels a lot more kind of homegrown, and people accept it a lot more quickly in the clinical side, rather than an eco-green team being purely administrators and people who work behind desks. Having boots on the ground say that this is important and champion ways to integrate it into our workflow without compromising efficiency or quality of care has been really meaningful. And for anyone who's starting these initiatives, I would say, the gateway for anyone who wants to really tackle this, I would recommend a waste audit. Just start with your floor, your OR, whatever your clinical area of practice is, your outpatient clinic, and see what kind of waste you make in a day. And the efforts you put towards that in terms of meeting your environmental services people, meeting environmental fairs, going through the trash, understanding what your use of various supplies is, gives you so much information and such a strong foundation as an easy thing to do as a first step. And you'll know where to go from there. It'll really guide your next steps. And as you scale out, if you get more involved in this work, what I've come to find is the administrators are looking for a clinical voice. There's policy being pushed at a national level to start really looking at healthcare and its carbon emissions. And there isn't a lot of expertise. And making sure that this kind of effort and these policies and the implementation of more sustainable practices aligns with clinical care is a priority and a growing one at kind of the hospital level. And they need clinical voices to actually understand how this is going to work and move this forward in an effective way. So if you're interested, I would just highlight that this is an opportune time to get involved.
Can I make one double click on that? Make one somewhat controversial comment. I hope it's not that controversial. But Shannon, as you think about the demographic shifts, in the next 15 years, millennials will be the dominant healthcare workforce and the dominant patient population, right? And as you think about awareness, I'll say as you go down in the age levels, I'll say anxiety, apprehension, and more activism increases as you go down. So as this population ages into the workforce and the patient mix, right, I will reckon that they'll begin to demand more of these initiatives from their health systems, both, like I mentioned, first of all, the moral imperative, but also as, most hospitals are the biggest employers in most towns in this country. So I think there'll be a clarion call that gets louder and louder and louder and louder. So in many ways, I think begin to think about these issues now is probably the way to go. And in many ways feels inevitable to me, I should say.
There's some great data to back that up if anyone's interested. The Yale Center, I have no affiliations. This is a purely altruistic endorsement, but the Yale Center for Climate Change Communication has really impressive data that completely backs up everything Ani just said. You couldn't be more spot on.
So we need to be focusing on this. And I guess kind of balancing on that, kind of thinking of the upcoming generation, clinicians, patients, is there an opportunity to build a career that is a balance between climate change and clinical care? Elizabeth, this is like Liz, this is your thing, right? Like, so tell us, like,
there better be.
But how do we operationalize this better? Is this something that should be part of medical school curriculum? Where can we make an impact? Obviously you all are doing this great work, but how can we get beyond, our centers?
I'll take that one off the bat if that's okay. I think one of the things I've learned in my 2 kind of research years during my residency and really focusing deeply on this topic is that there's a real dearth of data-driven work in this space, both on quantifying the impacts of climate change downstream on our patient outcomes, and on the flip side, how to make surgical care or medical care more sustainable broadly. And there are methods that are incredibly applicable to this space. One that many sustainability providers will know about is called life cycle analysis, where you can actually quantify your impact on carbon emissions with different changes in which products you buy and how you implement your systems. And being able to produce that kind of data for our clinical providers, whether it be in your outpatient clinic or in the OR, so you can make more informed choices that align quality with sustainability, is a really important next step. And understanding how to implement that kind of research needs a clinical voice. It can't just be these kind of environmental practitioners who don't have a sense of how clinical care works on a real day-to-day basis. So having an increasing number of providers who are interested in this overlap to inform that research, I sure hope is going to be a valuable contribution to the academic literature, because I'm slowly building my career upon it, and it's quite the gamble.
No, I think it's a very safe bet, Liz.
No, I think yeah.
So I think as a clinician, academic or community based, sort of, I'm late early career at this point. So the way I think about moving forward would be, one, Liz just talked about scholarship, right? Both empirical, data-driven work, as it is thought pieces like the JCO paper that have a policy inclination. I think we need much more of it. I think if you look, and there's increasing activity in this space, but nowhere near commensurate with the gravity of the problem. So that's number one. I think number two is actually just advocacy, right? In the same way that surgeons are very compelling and effective advocates for gun violence, for COVID related science, for health equity, I do think there's a huge space for physicians, surgeons, medical oncologists, primary care doctors in this space from an advocacy standpoint. And I think sort of the more imperative argument I touched on, the fact that we are typically in healthcare the largest employers. I mean, healthcare is, depending on the year, almost 20% of our GDP, of our economic output is a huge chunk of it is healthcare. So we are buying legitimacy to sort of have this bully pulpit on this issue. That's number two. And number three is sort of a clinical practice, right? I think one thing about climate change is like the ultimate tragedy of the commons, right? So like, how can one person, make a difference? I think if everyone has a position, nothing is going to happen. I think the key thing is that we all begin to move in this direction, because as I like to say, incremental change is not insignificant change, and there's certainly the proverbial burning platform right now on this topic. So I think as we begin to have our clinical practice, each of us individually, sort of be more aligned, either from an adaptation standpoint or mitigation standpoint, with sort of reducing greenhouse gas emissions, I think that's a huge benefit to us, future generations. So that's sort of the three main ways: practice, advocacy, and scholarship that can build this into our careers.
Yeah, not to get into a total mentoring conversation here, but Liz, there's a huge opportunity for policy. And through our own home organization, ASCO, there's a policy fellowship. There's lots of opportunities that I think that you'll find your academic career could be supported by. So just a little off, a little off note.
I appreciate the recruitment.
So what about some inspiration as we kind of close this conversation? And you guys have kind of peppered this throughout, but maybe just, summarize a little bit, like a 1-2 minute. What are you doing in your own practice, as well as like your lives, like out of hospital lives, to contribute to these efforts?
Liz, you want to go first?
Yeah, I'll start. I try to live my life with a perspective of sustainability kind of in every aspect, but with an informed perspective, because I really do believe that quality of life, just like quality of care, does not need to be compromised in order to be green. And so being really informed about what choices in your life and your actual career have a true impact, and an impact that can scale, is really important. So, do I try to buy the least plastic that I can? Certainly. Do I kill myself to be completely waste-free? I do not. But I try to amplify the need for these kinds of interventions across my own little local network, both socially and wider in my own career. And as I started to pull this into my workplace. I was apprehensive about what the kind of reaction was going to be from pushing a sustainability perspective. And I've been really, pleasantly surprised and impressed with how many people in our workplace already, like me, are doing what they can at home and just don't know how to start in the workplace, and especially in a hospital. And so being that champion and having that voice to start wherever you are, whether it be a small project or a big policy initiative, whatever you can take on, I would say is kind of the inspirational next step. And as you see the reaction of your colleagues, I hope, like me, you will continue to be inspired to do more.
Great. Ani?
So I'll lead off with a plug. So I read this book called The Uninhabitable Earth. It's by David Wallace Wells. And I thought that book is the most compelling argument to really just think about climate change, and just it really created a sense of urgency within me. It came about 2.5, maybe 3 years ago. Compelling read. So I'll just start off with that. There are many sources that are available now. I think the National Academy of Medicine, they have a grand challenge and an action collaborative on decarbonizing the U.S. healthcare sector. And they have a bunch of resources on their website, so I'll certainly point many people to that. So what I do in my daily life, the way I've thought about this is, what behaviors can I entrench in the long term? I think human beings, physicians in particular, I say we're a high resistance pathway. Old habits tend to come back to the surface. So I've really focused in the last 2 years on sort of embedding certain climate sensitive practices in my life that I hope to continue moving forward. So one of them is AI driveless. Now, it's not super easy in Houston, Shannon, as you're aware, but I happen to live near the light rail, and for the last 9 months, I've been taking the training every morning to work, to and fro. Allows me to read, allows me to sort of like zone out. I put a podcast on, ASCO podcast after hours.
Love it.
So that's one. Number two, it's just easy. My purchasing choices have a climate lens. So in many ways, you could say what you buy reveals your preferences like nothing else. So when I bought it, a new radio, a new TV. I look for the sticker that says EPA certified. It's a little thing, but it's something that I'm able to maintain for the last 2-3 years now. So I'll say being informed, changing my commuting habits, and changing my spending habits are sort of like the ways I've just sort of like really embedded this into my daily life.
That's great. And I think there's so many great resources that you guys have mentioned. So I hope our listeners will check it out. I will put a plug in. I love to compost. Super easy to do, and you can use it to grow food and beautiful flowers. And so that is something that my husband and I have been doing for years now. So another simple little thing where you can get everything online. It's magical. So, all right, guys. Well, this has been incredible. I have so enjoyed getting to chat with both of you, and I hope our listeners have the same feeling. Just as a reminder, this article can be found online in the March version of the JCO, Prescriptions for Mitigating Climate Change-Related Externalities in Cancer Care, A Surgeon's Perspective. Many thanks to my guests, and you all have a great day. I'll hope to see you next time.
Happy to be here. Thank you so much for having me.
Thank you so much.